Hi, this is Shelley Hitz, and I'm going to explain to you the lumbar and cervical spine and a little bit of why posture can affect your pain. What you can see here is you have the spinal column, you have the bones, which are the vertebra, and those are hard. Those aren't going anywhere. Then in between those you have what are called your discs, your intervertebral discs, and those are soft and more movable and changeable. So for instance, I use an example of either a balloon or a marshmallow. They'll move a little bit depending on what your position is. So those are your discs. This is your vertebra. Then let's come to the side here, and you can see all of these little yellow things coming out of the sides. Those would be your nerves. So they come off of your spinal cord, which is protected inside of the bones, and then you have the nerves coming off. What happens oftentimes with neck and back pain is, you can see an example on this diagram here, is this is an example of a bulging disc. What happens sometimes with different positions and different postures is the disc can bulge slightly. What can happen because of the bulging is that it can put pressure on the nerve. In the neck, that would put pain into your shoulder blade or into your arm. In the back, that could put pain into your leg or your hip. And this is not the only cause of back pain, but it's one of the most common causes. So when you bend and you're sitting in that flexed, bent posture, what happens is the bones come together in the front and tend to move that disc a little bit backward, closer to that nerve. What you can see here is your normal posture is a slight inward curve of the neck and a slight inward curve of your lower back. Now when we sit in a C curve, what happens is we lose those curves. So we just become one big C curve, when we're sitting. A lot of times we slouch. What that does is it puts more pressure on our ligaments, on our discs, and all the different structures in our back and our neck. And so what we want to do is try to sit with a nice, good posture. And we'll talk about that a little bit more in detail later. But you can see the anatomy, the basic anatomy of the spine. On the sides here where the disc or where the nerves come out, you can see here is where a lot of times you have a little bit of stenosis that happens. That narrows, that opening might narrow a little bit and cause a little bit of stenosis in there. So there is the basic anatomy of the spine.